When you're pregnant, you ask yourself a lot of questions. Is there anything in our genetics that could cause problems for the baby? Not too long ago, we didn't even know if it was a boy or a girl until the baby was born. Today, we can pick names, nursery colors ahead of time, and a number of other things concerning our baby's health can also be predetermined. Joining us with why a preconception checkup should be part of family planning, welcome back Dr. Diana Racusin and certified genetic counselor Jennifer Hoskovec with UT Physicians. Good morning.
Thank you.
All right, so sometimes when we're planning to have a family, we'll think, okay, let me eat right, let me get my weight right, let me do all that type of stuff, but we don't think about doing the unseen things like the genetic counseling. So important to go ahead and plan before you even get pregnant, before you get home and pull out that EPT test.
Absolutely. So when we do preconception counseling, we talk about all the things that might be in a patient's history that they haven't thought about. Diabetes, high blood pressure, thyroid disease, weight, things that can affect pregnancy that once we're pregnant, kind of the horse is already out of the barn.
Right.
We can improve pregnancy outcomes by improving the condition that our patients are in when they get pregnant.
Yeah. Even things like taking your folic acid, right?
Absolutely.
Yeah.
Like, for example, we want patients taking folic acid or prenatal vitamins for months before they get pregnant.
Yeah. Then there are other things. For example, I have sickle cell trait. And so we know that somebody else with sickle cell trait, there's a chance of producing a baby that has the anemia, right? So there's those things, like I mentioned, that we don't know or, that could really harm our babies too.
Absolutely. So genetic counselors typically visit with families who have genetic conditions in their history, such as sickle cell trait, a very common one. However, what a lot of people don't know is genetic counseling and genetic testing is really helpful for the entire population of patients, particularly those interested in having babies.
Yeah.
So there are genetic tests that can be done to help you identify if you do carry a trait such as sickle cell or a variety of others that can impact the potential of a baby having a genetic condition.
How many times have people come in to get this testing and then realize that they have something they never knew?
Oh, I think the vast majority
Absolutely.
of patients who have genetic testing that is abnormal, it's a surprise to them, but then at least they have the information and we can help them kind of process what that means for them and their families.
Yeah, and there's so much more we know today than we ever did before. I mean, it was not that long ago that we're like, oh, we don't know, it looks like it might be a boy because you're carrying this way or that way, and we really did not know, couldn't
Absolutely.
tell. So we can tell so much more today on the cellular level than we ever could before.
Absolutely.
Yeah, the genetic testing has evolved dramatically even over the last 10 to 15 years. And so in addition to medical information, as we've talked about with sickle cell trait, screening for conditions such as Down syndrome, it does also lend to kind of the fun and exciting stuff like the sex of the baby.
Yeah, there are some things that when you know what it is, that you're just prepared to how to treat it. Other things that you might know what it is and know how to resolve the issue, right?
Yeah, so I think there's a lot of information we can get from genetic screening. Mm-hmm. Some things could be immediately pertinent to this pregnancy and to this baby. Other
like
things,
you mentioned thyroid, for example. In fact, when your thyroid's off, it can actually prevent you from getting pregnant.
Absolutely,
Right.
absolutely. So when we talk about genetics specifically, we can be a carrier of something like sickle cell trait, might not affect this baby, might affect choices we make in other pregnancies, depending, and it makes us allow for good planning and healthy pregnancies.
How far out should you do something like this before you think you want to get pregnant?
So I'd always counsel a patient to talk to their doctor, address what their questions or concerns are, and we're happy. I see patients that are going through infertility workups. I see patients who self-refer because they have a question or a concern. They're wondering, should I get pregnant? When's the right time to get pregnant? How can I balance any health issues that I have, possibly also with things like age?
Yeah.
Maybe I want to take care of some medical things first, but gosh, that clock is ticking and maybe I don't have 5 years to invest in this. So anytime there's those questions, we're happy to address them. It doesn't really matter how far out we are.
Yeah, and you all are different than just your OBGYN.
Absolutely.
Might not really have this full scope of what you all do, right?
We work with OBGYNs, general OBGYNs all the time. They refer to us. We just have that bigger time slot to sit down and talk about what all these things might mean.
Yeah. All right. For someone who's thinking about it, what should they look at in their family tree to make them even more willing to do something like this?
Yeah, so I think knowing about your family history, whether it's medical complications, pregnancy complications that your family, your mother, your grandmother, your aunts had, it's also important to remember it's not just about the mom, right? It's also about her partner and what does his family history
other half
look
of the
like.
DNA.
The
Yeah,
other half,
yeah,
right?
yeah.
We get half of our genetics from each parent. And so it's important just to look at that full picture and then also recognize that there are some things that can happen by chance and don't run in a family.
Yeah.
And so that's why asking the questions is important.
We talked about miscarriages earlier. So if your mother had several miscarriages, is there a chance that you might have?
There are some rare cases that there are some genetic reasons for miscarriage. Typically, that's not the case, but certainly if it's extensive in the family history, it's worth coming and having a conversation.
Yeah, almost anything that's extensive in family history, you got to look at.
Exactly.
Absolutely.
All right. Thank you, ladies. For more information on how to book an appointment at UT Physicians, call 888-4UT-DOCS. That works out to be 888-488-3627, or visit utphysicians.com.